Hello and welcome back to our channel. As many of you know, last month was a month of awareness, whether it was breast cancer awareness, autism awareness, or domestic violence awareness. Well, this month I'd like to talk to you about chronic stress awareness. Not necessarily a label for the month, but chronic stress seems to play a very large role in many people's lives, whether you're a caregiver, a person living with a chronic illness or a life-challenging illness, or you're just getting through your day-to-day life. Life here on planet Earth can be challenging. So I'd like to share with you today some skills that could be helpful for you and how microdosing of medical cannabis can also be helpful in overcoming some of the chronic stress that people live with day to day. I'm Shari Kaplan-Stellino, founder of Connected Wellness. So chronic stress can wreak havoc on your body. I'm not the first person to let you know this. This is why people have heart attacks early in age, how our immune system breaks down, or what you hear mostly about nowadays, inflammation. Inflammation of your body, inflammation of your mind. We have a lot of chronic inflammation. And so cannabis can be a very helpful tool for you to have when managing inflammation. But first, let me start with chronic stress. When your body is under chronic stress, your body is releasing more adrenaline and cortisol than it actually needs to get through your day. And this can wear and tear on your body and cause chronic inflammation. In addition to that, it can put you into a low level of a stress response. And when people have stress, like post-traumatic stress disorder, we know the brain locks down, we know the body goes through a whole physiological response that starts burning up a lot of carbohydrates, your stomach starts emptying out, so you have food for energy. So many different things happen in the body. And when you have chronic stress, your body is doing low levels of this at many different times. So number one, if you need help managing your stress, there are plenty of therapists out there that specialize in traumatic stress or trauma who have excellent skills and tools to teach you, like breathing, meditation, mindfulness. On a daily basis, you can practice certain skills as well as exercise and nutrition that can help you manage your chronic stress. The second thing that you want to know about is microdosing of medical cannabis. So this is what you need to go back and speak to your cannabis physician about. Number one, you can microdose for regulating and modulating the body, just the body's stress response. So having 5 to 10 milligrams of CBD twice a day, along with about a milligram of THC 2 to 3 times a day, can be very helpful in getting the body regulated so you're not as reactive to the stressors that are showing up in your day-to-day life. So having your physician evaluate how often you need to take it, whether it's 1 or 3 times a day, that's what you need to discuss with your physician. But about 5 to 10 milligrams, 1 to 3 times a day seems to be an excellent way to manage your chronic stress with CBD with 1 to 2.5 milligrams of THC. Now, the other area that you want to talk about with your cannabis physician is sleeping at night. A lot of people who struggle with chronic stress, whether they are the caregiver or the patient, getting a good night's sleep, we know, is very important to our well-being, and also being able to allow your brain, it's actually called your glymphatic system, to help your brain stay healthy. So you need a certain amount of hours of sleep a night so that your brain can function at its optimal state. So being able to have a good night's sleep using 5 to 10 milligrams of THC for most people is all that's needed. But again, speak to your cannabis physician to make sure you're getting the right dose for you. So just to recap, you want to get some skills and tools under your belt to manage your stress: mindfulness, meditation, exercise, yoga, Move your body, get a good night's sleep, eat nutrient-dense, unprocessed foods, hopefully organic or locally grown, and then your microdosing of medical cannabis, higher dosages of CBD, very small dosages of THC, and then THC at night. So now you are armed with a bunch of good information. Go out and get yourself a good stress management coach or a therapist that can help you if you really need some help unlocking some of that stress response in your body and managing your stress with skills and tools. I hope you found that information to be helpful. If you did, please like our video and subscribe to our channel. And remember, cannabis is a life-changing medicine, but only you can change your life.